If you've had your gallbladder removed, also known as a cholecystectomy, it can impact your body's ability to digest fats and absorb certain nutrients. And this really can have far-reaching effects throughout your body. Well, hey there, I'm Dr. Hagmeyer, and in today's video, I want to share with you a few important supplements you should be considering or even taking if your gallbladder was removed and you continue to struggle with symptoms. And I'll also explain why they're so important. Taking these supplements can have really just a remarkable impact on your health, and you'll see why and how in just a moment. First thing first, we need to understand just how important fat is in our diet, right? Number one, fat serves as a dense energy source, right? It provides more than twice the energy per gram compared to carbohydrates and compared to protein. So it's really important. If you walk around tired, fatigued, run down, your cells need fat as a fuel source. And if you can't use your fats for cellular energy, let's say because your gallbladder is removed, your energy levels are going to suffer. Second, bile, which is really made in the liver and stored in the gallbladder, is instrumental in the absorption of fat-soluble vitamins. So these are things like A, D, E, and K. Now these fat-soluble vitamins are necessary for various critical functions, including things like vision, immune function, blood clotting, bone health, hormones, immune system. And so if you don't have a gallbladder, you may have low levels of these vitamins on blood testing, especially vitamin D, since that's the one vitamin that most doctors usually test during an initial routine blood test. Now, number three, fats really contribute to the structural integrity of cell membranes. This allows cells to really talk to one another. We call this cell signaling. Fat also plays a role in the protective aspect of a cell. The fat layer surrounding the cell prevents harmful substances from entering the cell while allowing essential molecules to really pass through. Now, if you're a patient of mine, then you might remember me talking about something known as oxidative stress and the cell membrane being made up of fat. Well, the types of fats that we eat, in this case, the type of fats that we don't absorb, can't be incorporated into that cell membrane. And so that becomes a major problem when we don't have a gallbladder. Number four is dietary fats are vital for the development and the functioning of our brain. Remember, 80% of our brain is fat. So having fat supports cognitive process and mood and regulation. And when we don't have a gallbladder, we're going to have problems with fat absorption. We can struggle with focus and concentration and all kinds of problems related to the brain. Again, 80% of that brain is fat, so we have to make sure that we're absorbing our fat. Again, when you don't have a gallbladder, guess what happens as far as fat digestion goes, or fat absorption for that matter? Again, you might suffer with diarrhea or fatty, greasy stools. You might have abdominal pain. You might have a mild pain after you eat. Some people experience bile reflux where, again, they have diarrhea. You can have acid reflux. This might happen and cause symptoms like heartburn and nausea and gastritis, again, as well as bloating. So while most people adapt over time, not having a gallbladder does take a toll on you and does affect your vitamin levels. Now, if you're struggling with any of these symptoms that I mentioned, or you just want to be, let's say, proactive because, let's say, your gallbladder was removed, there are 4 supplements that really can prove super beneficial to you. Number 1 is ox bile. Number 2 is going to be digestive enzymes. Number 3 are going to be your fat-soluble vitamins, A, D, E, and K. And number 4 are going to be your omega-3s. Remember, your gallbladder's role is to store bile, which aids in fat digestion. But when you don't have a gallbladder, bile may not be as concentrated, so ox bile supplements can help improve fat digestion and overall nutrient absorption. Digestive enzymes are important and necessary because they assist in breaking down fats and proteins and carbohydrates and minimize those symptoms like bloating, gas, indigestion, and even food sensitivities that many people who don't have a gallbladder often experience. Lastly, fat-soluble vitamins like A, D, E, and K. And again, your omega-3 essential fatty acids, because again, these nutrients are going to be poorly absorbed due to less efficient fat digestion. Now again, taking these vitamins that I just talked about in today's video can really help ensure that you're meeting your nutritional needs. All right, well, that's gonna wrap up today's video, but as a disclosure, which I have to always say, when it comes to taking supplements, it's always crucial that you consult with your healthcare provider to determine the appropriate supplements, the appropriate dosages for your specific condition. And also, to check for potential interactions should you be taking any kind of medication. Well, I hope you liked today's video, and if you did, here's another video that I think you might like watching as well.